Good evening, everyone, and welcome to Pull Up with Limbs and Things. Tonight it's just me, and we're going to be talking about some frequently asked questions that Limbs and Things usually receives, as well as celebrating Caregiver Month. My name is Dr. Chanel James, and I am the owner of Limbs and Things mobile and telehealth, physical therapy practice. So, our goal with Pull Up with Limbs and Things is to confirm something you know, challenge something you don't know, and give you an opportunity to share that information with someone else. If you are watching us live tonight, please hashtag live in the comments. If you are catching this after we've aired live, please hashtag replay in the comment section. If you have a question at any point while we're talking, put it in the comment section and I'll do my best to answer them before we end. All right, so we were talking about frequently asked questions in that we receive for Limbs and Things. Hi, Brandon. Okay, so the first question I usually get is, when should we see you for physical therapy? And usually it's from family members, and they're trying to see if they should seek physical therapy before or after a person has had an acute situation. So, say you go to the hospital, you've gone to rehab or a skilled nursing facility, and then you've come home. You want to see home health before you see us. Once home health is finished, then that's a good time to call Limbs and Things. If you are already at home, you haven't gone to the hospital, there's nothing necessarily preventing you from calling us right away. And you can get physical therapy services with us by calling our number. I'll put it at the bottom of the screen. Let's see if I can do that now. Okay, so our number is 202-643-2636, or you can contact us online at www.limbsandthings.com. All right, so that was the first question. When do we see you for physical therapy? Because we are considered outpatient in your home and we do take Medicare B and TRICARE insurances, you would have to see us after you've seen a home health therapist if you've come home from having an acute situation. But if you are already at home, you can see us right away. So, another question we tend to get is, how do we pay for your services? So, you can pay through insurances or you can pay cash pay, which is our favorite. A lot of healthcare professionals prefer cash pay because we get paid at the time of service. When you use your insurance, it could take us up to a week, maybe a month to get paid. So that is why we all prefer cash pay services. Okay. Where are we located? Yeah, that's an important question I get a lot. I thought in saying mobile physical therapy, that would be kind of clear, but sometimes that's not always as clear. So, mobile physical therapy practice means that we come to you. You can be at home, you can be at a facility. Um, so long as you're using your Part B benefits and we verified all of the ramifications that would prevent us from seeing you, then we can see you in those environments. Okay, so first question is, when um, you should seek us for physical therapy services, and that would be if you've had an acute situation, you want to have us come in after home health is gone so that you can use your Part B benefits. If you're using cash pay, it does not matter. You can see us right away. And then if you're already at home, you can just call us and we can come out. So we do take TRICARE, we take Medicare Part B. That's part of your outpatient physical therapy services benefits. So that means that you receive outpatient level care, but in your environment. So in your home. And if you are in a facility, we can see you for that. All right. And where are we located? Wherever you live. We are located right where you are because we come to you to provide services. All right. How long does it take to be seen? You can be seen within a week of contacting us. We try to set aside time each week to see any new patients. All right. And then outside of direct physical therapy care, other services we provide are making sure that we provide community outreach. We try to do that through Pull Up with Limbs and Things, but also paid speaking engagements and caregiver trainings as well. And since it is caregiver month, we want to recognize all of the caregivers that we work with, as well as those who are family members who are caring for someone. If you are a paid caregiver, this is your month to be celebrated. So, a way that Limbs and Things constantly works with families is making sure that we are providing training for you to be successful in working with those who you're working with on a regular basis. So, doing so through, well, let me tell you a story. A good example would be a patient who has been what we consider a max assist of 2, meaning that the person is not able to help as much as you would like for them to be, and you have to have 2 people to assist them moving from one surface to another. So we had a patient to start from that level, and the caregiver was not able to do it independently, and she was there alone with that patient trying to move them from place to place, but decided that that was just not going to happen because it was an unsafe situation for her. So we've been working together so that that caregiver can get the person out of the bed. And so now they are able to transfer or move from one surface to another with one person. And the assist is now minimal assist. So max, the assist levels go from max, mod to min. And so this person has been able to go from max assist of 2 people to min assist of 1 person. So that caregiver now is able to move the person from surface to surface independent of having me in the home to assist. So our goal is to always get people to their optimal functional level to be as independent as possible. And so if it requires having a caregiver get trained on how they can do it more independently, more safe, in a way that does not injure themselves or the patient, that's our goal. And so we do that through caregiver training one-on-one in sessions, but we can also provide that service to facilities and to people who are trying to improve their co-worker cohort so that nobody injures themselves. We want to prevent injuries, not cause them. So, as always, we want to give you an opportunity to ask any questions you may have. So, if you do have a question, please put it in the chat. If you think of it after this has aired, you can put it in the comments. I'll answer it. All right. So, again, going back over some of those questions as you think about a question you may have, we want to make sure that you know that Limbs and Things provide services in your home. You can be seen through your Part B benefits with Medicare or TRICARE. And if you don't have those insurances, we can verify your out-of-network benefits with your commercial payers. All right. And then the other question was, when can you see us for physical therapy services? So that would be if the person has an acute situation or you've been to the hospital, you're coming back home, you want to make sure your home health episode is completely over, you've been discharged from your home health company, then you can call us for outpatient physical therapy services in your home environment. Okay. And then it does not take that long to see us. We try to see you within a week of contacting us because we know that the sooner you get physical therapy, the better your results will be in being functionally independent. And our goal is to help you move from I can't do something to I can. All right. All right. I'm checking to see if you have any questions or comments. I do hope that's answered some questions that I've been getting lately. And then speaking engagements and caregiver trainings we do to make sure that we're doing a complete continuity of care so that no one is left out in terms of the way that we should be operating so that you're safe and so that you prevent injury to yourself and to those who you're caring for, especially from the caregiver perspective. All right. All right. Seeing no comments, I'm going to let us end. All right. Thank you so much for joining us. Again, pull up with Limbs and Things is to confirm something you know, challenge something you don't know, and to give you an opportunity to share that information with someone else. Have a wonderful November.